Just a few days ago, I received this comment from a lady whose name is Diana. Here's what she wrote to me. She said, "My Advantage plan made my local hospital out of network. I have changed to another Advantage plan, and now I've been told that as of April, most of my doctors will be out of the network. This will be outside of the enrollment period. Not sure what to do now." Folks, this is not an isolated problem. This is a common problem with Advantage plan. So in this video, what I'm going to talk about is why does this happen, this network issue, how to avoid this particular problem, other problematic issues with Advantage plans, and then lastly, how it is that you can fix the problem. All right, so I want to begin by addressing this question: why does this network problem happen? Why is that? Well, folks, when people decide to go on Medicare, they're off their company plan and they're ready to retire, they go on Medicare, there's really only two systems of insurance that are available to people, all right? And so what happens, here's your two options. One is to enroll in original Medicare A and B, where Medicare directs the care, and then most people get a supplemental plan to fill in the financial gaps with the things that Medicare did not cover. The other option is to do what's called a replacement plan, and these are also referred to as C plans or Medicare Advantage plans. In fact, about half of all people do this, and about 40% of the other people do that, and 10% have nothing beyond A and B. But the whole point is that why does this problem happen is because there's people that say, I don't really want to have one of these supplemental plans. I want a Medicare Advantage plan. Now, what makes these very attractive is, other than paying Medicare, you still can get a plan with Medicare Advantage that has a zero premium. Again, we're still paying Medicare, that Part B premium this year, $174.70, but the Advantage plan 2 out of 3 times offers you a plan of insurance with no premium to them whatsoever, and so people like that. Also, Advantage plans have all kinds of perks. They have a free gym membership. They'll give a dental allowance, sometimes hearing aids, maybe a vision allowance. They may give you an over-the-counter card, so they have a lot of perks with Advantage plans, and so people find those to be very attractive, and so they will enroll into an Advantage plan. Okay, but the issue is this: when you have an Advantage plan, you're always going to have a network of providers. Okay, network. And those networks are going to be either an HMO network or you're going to be in a PPO network. And what happens is, anytime we have a network, now we have limitations of providers. We have restrictions also placed upon these networks. And so what happens is, if someone enrolls into that Advantage plan, now they're going to be subject to seeing the doctors that have agreed to see those patients. And sometimes a doctor will agree to do it this year, and then they say, no, we didn't have a good experience, they didn't pay us quickly, didn't pay us enough, and they come out of the network. We've even seen full hospital groups coming out of Advantage plans. So again, when someone enrolls in a plan, sure, zero premium, and some of the perks are very attractive, but now they're going to be subject to networks. So that's why this problem happens. All right, secondly, let's talk about this. How can you avoid the problem? Again, let's go back to two options whenever we enroll into Medicare. How do you avoid network problems? You just say, I'm not going to enroll into an Advantage plan. You instead choose a supplemental plan, because in this system, it's different. Here, I had a private health insurance company that is really directing everything, puts together a network of providers. Here, what happens, original Medicare, the system that began in 1965, is what's directing the care. We're under the guidelines and the rules of original Medicare versus a private health insurance company. And so when people want to avoid network problems like this, Diana, then what you do is you enroll in A and B and you get a supplemental plan. Why is that? Well, here we have no network whatsoever to deal with. In fact, what we call the original Medicare system is an open access system. Open access, which just simply means that you can go to any provider, any hospital, any doctor, any surgeon, any durable medical equipment provider, any provider that actually takes original Medicare will take your supplemental plan of choice. Most people today are either getting a G plan or an N plan, and as long as the provider takes original Medicare, they will take that supplemental plan you've chosen. So that's the way to avoid it. Instead of opting for the zero premium plan, the one that has some perks on it, with the networks and all these other restrictions I'll talk about, then you can just simply enroll into into that Medicare supplemental plan. Well, are you going to have to pay a premium for it? Yes, you are. You're going to have to pay a premium for that supplemental plan, but what you get is you get this open access system as well as some other wonderful benefits by being on that supplemental plan. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, just beyond the network issue, I think it's very important to note some other what I call problematic issues, or what I would say are disadvantages of Advantage plan. And again, all these are critical to know. Number one, Advantage plans are not portable. Not portable. Okay, well, what does that mean? That means, let's say you live in Denver, Colorado, and you're going to move to Miami, Florida. You are not going to take your Advantage plan with you. You're going to have to get a different Advantage plan whenever you arrive in Miami. You're going to have to get different doctors and be subject to a different network. Why? Because Advantage plans are tied to a service area. They're really not tied to you. They're tied to a geographical service area. So as long as you live in that service area, that plan is yours. But if you move away, then you don't take it with you. Not so with Medicare supplemental plans. If someone bought a supplemental plan, they lived in Denver and they moved to Miami, they're going to take that supplemental plan with them because that insurance company does not cancel that policy. It is yours for life as long as you pay the premium. All right. And so portability becomes a big deal, especially as people age. They're concerned about their insurance. What's it going to look like if they move? And so if you have that supplemental plan, it is a totally portable plan. Advantage plans not portable, but supplemental plans are portable. So that's a problematic issue. The second one, and really even a bigger one than this one, and that is this, pre-authorizations. Pre-authorizations, okay? So we said that with Advantage plans, we have networks, and we also have they're not portable plans, but also Advantage plans, about 70 to 72% of the time are going to require a pre-authorization. That's a lot. So you can see a primary care doctor without a pre-authorization. You can get lab work and some general things done. But the majority of services that people need on the Advantage plan, 70 to 72% of the time, now we have to have the insurance's approval. That's what a pre-authorization means. So doctor recommends something, but that's not the final word. The insurance company has the final word. And so pre-authorizations are problematic. Why is that? Well, because now the insurance company has the final word on, are you going to get that knee or hip replacement? They may say to you, no, we're not going to cover it. We want you to go to therapy for 9 months. We want you to try meds for a certain period of time. You may need an extended skilled nursing stay. And only if the insurance company agrees are you going to get to stay for a longer period of time in the skilled nursing facility. If you need an MRI or a CAT scan, those are expensive. And they may say, no, we want you to do this first. And so they put criteria. That's a pre-authorization. Here's my point. If you're on an Advantage plan, the doctor recommends it, but the insurance company must agree and must approve. And sometimes they do immediately, but sometimes they delay and sometimes they deny because they have the right to do that. If you have that supplemental plan, you will never have a pre-authorizations. These do not exist with supplemental plans. Why? Supplemental plans follow Medicare. If Medicare says we'll cover something, doctor says you need that service, that surgery, that knee replacement, hip replacement, MRI, CAT scan, you get it. No questions asked. Why? Supplemental plan cannot interfere in any way. If Medicare covers, they have to cover. No questions asked. All right. So again, the simplicity when somebody has some real serious health issues, it's much easier with the supplemental plan than it would be on the Advantage plan. And then the last item I'm going to mention is this. What happens whenever you get into an Advantage plan, and let's say you stay on that Advantage plan for a year, 2, 3, 4, 5 years, whatever, and you stay on that plan and you would like to actually switch. So you're on the Advantage plan and you say, I'm tired of these networks like this Diana was. I don't want to be subject to pre-authorizations any longer. I'm done with that. And you want to switch over here and pick up that supplemental plan. Here's what happens. Again, you've been on that Advantage plan for a year plus, and now to move to a supplemental plan, now you have to medically qualify to make that move. You just can't do it because you want to. A lot of people, they'll get an Advantage plan, stay on it for maybe 3 years, 5 years, and say, well, my health changes and I'll switch. Well, you're not going to be able to. Why? Because to make that switch now, except in 4 states, let me clarify, this rule I'm teaching you does not apply in New York, Connecticut, Maine or Massachusetts. All the other 46 states and DC have this rule. Once you've been on the Advantage plan and you want to move to supplemental plan, now you have to go through medical underwriting. All right, so what happens? That means this. We're going to have to ask you 30 health questions. We are going to check all your prescriptions that you're taking now and half of the last 2 years, and we're probably going to have to get a statement from your doctor. And that medical information will be given to the supplemental company, and they can either deny you, reject the application, or they can approve it. And so if they see some kind of pre-existing condition in your records they're not happy with, or a medication you're taking they think is too strong, too addictive, whatever, then they absolutely can deny the application. They do not have to take you. And so many people would like to get off of Advantage and move to a supplemental plan, but now their health has changed and they cannot medically qualify to do that. And now they're going to be stuck then in that system for the rest of their life. All right, and so that's a problematic issue. Yes, networks can be a problem. Yes, pre-authorizations are definitely a problem. The portability of the policies, but also the fact that an Advantage plan, if your health were to change, you could be on that thing permanently because you can't medically qualify to make that switch. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, so what can you do about this? Maybe you just become aware of the problems with networks or these other things that I've talked about, issues during this video, and you would like to fix the problem. Well, first off, let me show you how you fix the problem. So first off, if you have not on Medicare yet, you can fix the problem immediately by starting Medicare with that supplemental plan. And let me show you why. Let's just say that someone is having a birthday 3/15/1959. Okay, 3/15/1959, they're going to retire and they want to go on Medicare. They'd be eligible for Medicare A 3/1/2024 because remember, we're eligible for Medicare 65, and they'd have Medicare B 3/1/2024. Okay, so what happens when we first start Medicare is Medicare gives us in every single state this once-in-a-lifetime opportunity to be able to get any Medigap policy that is sold in our state without any underwriting whatsoever. You can pick the plan you want, you can pick the carrier that you want in your area, and you can enroll in that plan, and they have no authority whatsoever to deny you. They have to take you. We call this guaranteed issue. And so that guaranteed issue right is only lasts for 6 months. So what happens, it's all tied to the B date of Medicare. So I can actually apply 6 months before. Now, my policy is not going to start until my B goes into effect, but I can apply 6 months in advance, and then this period of time, and we call this the Medigap OEP, Open Enrollment Period, okay? And it lasts for 6 months after the B date. So I can apply 6 months in advance, but once I've hit my B date, I still have this 6 months where I'm still in this period of time where they have to take me, they have to cover all my pre-existing conditions, they can ask no health questions, I'm guaranteed to have that policy. That 6 months in this example would be all of March, April, May, June, July, August, okay? Which means what? In my example here, from September 1, 2024 on, except in those 4 states I mentioned, New York, Connecticut, Maine, Massachusetts, in order to get a supplemental plan after this 6-month window is now closed, you have to medically qualify. Just like you had to if you're going to get off the Advantage plan and move over to a supplemental plan. You got to medically qualify now after that particular 6-month window. So it's very, very important. So how can you fix this problem so you don't deal with the networks and the pre-authorizations and all the issues that come with Advantage plans? You can take care of the problem immediately if you start with a Medicare supplemental plan. You'll have an open access, no pre-authorizations then for the rest of your life. Okay, so that's how you fix the problem, number one. Let me show you a second way you can fix the problem. Now, the second way would be during these particular dates. Now, let me clarify something. This is someone that actually started with an Advantage plan, or they're on Advantage plan now. Advantage plans can be switched this way. We can do Advantage to Advantage 2 times a year. Advantage to Advantage, October 15th to December 7th. And if someone makes a switch during this time, then that plan would go into effect January 1 of the following year. Okay, now we also have another period of time, the first quarter of every year. If I'm on an Advantage plan, January 1, I'm on one already, then the first 3 months, again, I can move Advantage to Advantage. If I make the switch in January, my new Advantage starts in February. Make it a switch in February, starts in March. It was actually start in April. All right, so the point is the first quarter of every year, we can fix these problems. So what we have the right to do is switch Advantage plans, but we all also have the right to do what? Get off the Advantage plan and return to traditional Medicare. So we get that traditional A and B, and we can actually add a prescription drug plan as well. Now, remember, if I have been on that Advantage plan a year, 2, 3, 4, 5 years, to make that switch, I still have to go through underwriting. But again, as long as you're halfway healthy and don't have any kind of serious health issues going on, you can fix the problem during this 7 weeks. You can also fix the problem during the first 3 months of every year. Now, after that, you'd have to wait. So if you decide, hey, I'm wanting to fix the problem and now it's in April, it's too late. You're going to have to wait till later in the year. But we do at least have these opportunities, 7 weeks at the end of the year and the first 3 months of every year where you can fix this problem. And then lastly, sadly, I have to share this with you. How to fix a problem? Well, some of you, maybe never. And why is that? Well, because you missed that original OEP where you had the opportunity to get that supplemental plan of your choice. Remember that 6 months of your B date. Or you've been on that Advantage plan for a few years and now you cannot medically qualify to make that switch. And so it's very sad when this happens. But again, I've seen it plenty of time when people wanted to get off their Advantage plan to get a supplemental plan and they cannot. But point is this, if you can't fix the problem, we'd be delighted to help you through that to make sure that you get a plan that's going to suit your needs well.